Hello, good afternoon. I'm going to record the presentation I did at noon today on combating autoimmune challenges naturally. There was some audio disturbance, so it's very annoying and quite distracting. So we're going to go over the slides again so I can send it to the folks that were interested in this topic and that weren't able to come. And for all of you that were able to join me this afternoon, here's a replay so you can go back and review the material that we covered. So bear with me. I'm going to share screen right now, and we're going to start going over what we covered today. Okay. And I'm also going to stop my video so I won't be a distracted. Okay. As I mentioned, I'm Cherise. I'm a nurse practitioner. I've been a nurse practitioner since 1999. I'm the gal on the right, as you already saw. My background is in internal medicine. I was very blessed because I got to work with a lot of beautiful patients and work with many body systems. In 2015-16, had some health problems of my own. I was middle-aged and got very tuned in to functional medicine. And it gave me an additional set of tools for my toolbox. And I feel very blessed to be able to practice functional medicine now here in Victoria and treat many patients in Victoria and from the surrounding areas. I actually do telehealth video appointments for patients throughout the state of Texas. The guy also in the picture is my husband, Steve. He is a compounding pharmacist. He is a functional pharmacist. He is becoming more and more the guru on supplementation and lifestyle management, and I'm grateful to have him as my partner in crime. So let's get busy because we have a lot of material to go through. Combating autoimmune challenges naturally. You have to start this talk with what's functional medicine, because a lot of folks don't know what sets apart functional medicine from conventional medicine, which is my background before I became a fellow in functional medicine with the American Academy of Anti-Aging and Metabolic Medicine. The main differentiating principles of functional medicine is rooted in personalized care, precision, individualized care, treating root cause or diving deeper to find out the root cause and treating it then rather than just symptom management. It also tunes in or dials in to trusting and letting our body heal itself and empowering the body, empowering the patient to heal themselves. And in doing so, patients end up with a better understanding of imbalances in their bodies, how those imbalances affect them. And then obviously we give them a set of tools and solutions to hence go forth with and optimize their health. Functional medicine helps us redefine how we think of disease. Bottom line is disease is a condition that impairs normal functioning. And our current conventional healthcare model is disease focused indeed. If you feel sick, you go to a doctor or provider for a prescription to address the symptoms related to the disease. And once the symptoms are better, you are told, quote unquote, you're healed because your cough's gone, your nausea has gone away. I know that sounds familiar. This works awesomely for short-term issues to mask discomfort pretty quickly, but it has failed us in truly addressing chronic disease, which we here in the United States of America, we have an epidemic of chronic disease, and COVID has emphasized that. Those were the folks that were more at risk. Functional medicine practitioners recognize disease as the result of underlying causes, imbalances of the body, dysfunctions of various bodily systems. So when we think of disease as a result from an issue rather than the issues themselves, treatment can then be administered in a way to give the person long-term relief, sustainable health, and it empowers the patient, obviously, and keeps them away from the provider's office. So we're here to talk about autoimmune disease, and autoimmune disorders are diseases of the immune system. They manifest differently, but the common premise is the immune system gets confused, it becomes hyperactive, it begins attacking the body's healthy tissues because it mistakes them for foreign invaders. So there's this discombobulation of systems. So due to the lack of understanding of these diseases, conventional medicine works to treat the organs affected rather than viewing them for what they are. Diseases, an autoimmune disease is a disease of the immune system. There's no unified branch of medicine for these autoimmune conditions. There is not an autoimmunologist, as I like to say. Instead, in conventional medicine, and I'm guilty of this in the past, we refer to specialists trained in that specific organ system. And this strategy brings patients further and further away from treating their own immune system, and it results in a vicious cycle. And it's common from those that suffer from autoimmune challenges. When we don't put out that fire, we end up just adding another specialist as another organ ends up being affected from the chronic inflammation. So specialists you've heard of, and they're great at their job: rheumatologist, endocrinologist, gastroenterologist, physical therapy when we've got movement and stiffness in our limbs, dermatology. And while these specialties provide an important service and they are more than knowledgeable, they're experts in their specialty, there's a good chance they're not really equipped to address the need for truly supporting our immune system. Autoimmune disorders come in all kinds of flavors, right? You're used to hearing rheumatoid arthritis, psoriasis, psoriatic arthritis, the inflammatory bowel diseases like ulcerative colitis and Crohn's, but there's also multiple sclerosis, now type 1 diabetes. There's Graves' disease of the thyroid, Hashimoto's of thyroiditis. If you have one of these bad boys, you are at risk for another. All of them have two things in common. Number one, no brainer, the immune system's not functioning properly. And number two, a formal diagnosis in conventional medical treatment is required to receive treatment. You've got to get the label before your insurance is going to cover it. But fortunately, functional medicine providers don't wait for the label to happen before we start combating autoimmune challenges. We take a holistic approach to healing. We offer a variety of health assessment to collect numerous data points. We look at, there's genetic studies. Obviously, we obtain a personal and family medical history. We can do urine analyses. We do saliva testing for steroid, sex hormones, and cortisol, our stress hormone. We often do blood tests to look at thyroid function, vitamin D3, which is a pro-hormone. We can do nutrient profiles to see where people are deficient. We often do food allergy and sensitivity. Food sensitivity is almost more critical, and I'll get into that later. We do stool analyses to look for underlying infection. Again, adrenal stress saliva profiles. We look at a person's environmental onslaught, mind-body elements. We have numerous diagnostic tests to give us a larger amount of data to help the patient with. The most common root cause of autoimmune disorders are excess inflammation, a weakened bacterial environment, gut microbiome, the bacterial community of our gut. 80% of our immune system is based in our gut. So it goes without saying, you better strengthen that system in someone with an autoimmune condition. A weakened microbiome predispose them to having the autoimmune condition. We see intestinal permeability, which is a compromise of the lining of small intestine. You know it as leaky gut. We see chronic infection, oxidative stress, again, that magical food sensitivity. We are barraged by environmental toxins. We have to identify these so we can assemble an approach to combat these challenges holistically rather than just treating the symptoms. So in functional medicine, we use various strategies. Number 1, number 2, number 3, number 10, number 100 is addressing inflammation. With that comes looking at, this is where I don't always score brownie points with my patients, and Steve doesn't either when he's over at the pharmacy. We talk to them about dietary change, what's necessary, what's not, what's doable. Can we meet the patient in the middle? We talk about healing the patient's gut, precision supplementation so we don't break the bank. We talk about the importance of detoxifying, movement, treating underlying infection, and here's the hardest one of all, relaxation and stress management. Man, if I could figure out an easy way to do that one, I'd be on my way. It's the hardest. So we have to understand the role of inflammation to combat autoimmune complications. Inflammation in and of itself is not a bad thing. It's a vital immune response, and it's our body's attempt to defend itself against pathogens, heal that area from injury, and repair damaged tissue. It's necessary. But when inflammation becomes chronic, it worsens our body the body's ability to recognize foreign invaders. And so our body stays on high alert for prolonged periods of time. That leads to lasting damage. And this high alert autoimmune response ends up with the body attacking its own healthy cells. Inflammation is caused by a number of things. We already hit those up in the last slide. Many of those things overlap, and we have to address and discuss them in different ways so we can address inflammation. So the gut microbiome, you hear a lot about this. A very intelligent functional medicine guru named Dr. Jeffrey Bland came up with the 4R program. The gut microbiome or environment is an ecosystem of organisms, not just bacteria, but it's yeast, fungi, viruses, protozoan throughout our digestive tract. Again, the gut is home to 80% of our immune system. So an imbalance in these bacteria, an overgrowth of yeast, an underlying infection, or increased permeability of the intestinal walls. Again, you know it as leaky gut. Those are our primary causes, if not a prerequisite to someone developing an autoimmune condition. These issues can contribute to inflammation and they worsen autoimmune response. The 4R program, again, was developed by Dr. Bland. So it kind of simplistically lets us break down things so we can treat our gastrointestinal dysfunction. The first step, number one, remove. Man, if people just practice remove, I can make them feel better, help them feel better just by step one, removing possible irritants. This includes inflammatory foods, toxins, treating low-grade infections. And there's many ways to recognize the culprits of our discomfort. Food allergies, we can discover those by skin or blood testing. We can discover food sensitivities by taking part in a comprehensive elimination diet. We can know that common gastric irritants are caffeine, alcohol, non-steroidal anti-inflammatory drugs like ibuprofen, Advil, Aleve. We have to avoid these things if we can. We have to look for alternatives. We can analyze the bowel movements, the stool, to look for underlying infection caused by, again, yeast overgrowth, parasitic or bacterial infection. We can look at heavy metal levels in the body. And once we are aware of things that irritate your body's natural digestion, we can talk about removing them so we can regain some balance. Again, many of my patients, just when we work on number one, start feeling better, which is nice to get positive feedback when you're working so hard. So once you're confident that the antagonizing foods and irritants are no longer part of your diet, we've treated the infection, we've looked at toxin removal, then we go to number two. Forgive this slide, it says step number two in the black, but the label on the French fry hamburger plate still says step number one. This is actually two. We have to replace. This refers to replacing factors needed to optimize our digestion, like digestive enzymes, fiber, vitamins, vegetarian digestive enzymes versus animal-based digestive enzymes with betaine. Digestive enzymes are often found in capsule form, and they help us digest our foods, break down our foods so we don't feel so uncomfortable, absorb our nutrients, repair those intestinal repair the intestinal lining. They help us have two soft, well-formed bowel movements every day, not every week, every day. We can also do nutrient analysis and lab testing to look at your personalized nutrient needs. So we can provide you with personalized recommendations. So you're not just scatter shooting, right? You want precision supplementation because it's not always inexpensive. Step three, reinoculate. That's a fancy word for saying restoring balance of your gut bacteria. This is critical for immune activity, stabilizing our mood. Believe it or not, there is a very alive and well brain-gut connection. That makes sense. Also, 75 to 80% of serotonin, one of our brain neurotransmitters, is produced in the gut. So of course, to have a stable, steady mood, we have to have a healthy gut. There is a whole robust field of research on proper strains of bacteria needed in our gut microbiome to help us manage our weight, lose weight, maintain that weight loss. It's a very compelling field of study. Obviously, we need a balance of bacterial flora to prevent disease and communicate bodily change. We help repopulate our healthy bacteria by introducing probiotics and prebiotics into our diet. and we can talk about the differences. What the heck is a probiotic or prebiotic? So again, we're on Reinoculate. Probiotics are live bacteria, and you can find them in foods. We always want to start with food first. Yogurt, kefir, sauerkraut, tempeh, miso, kimchi, kombucha. These promote a healthy balance of bacteria throughout our digestive tract, and they can help us in our fight against many of the gut-related chronic illnesses. Again, we found out with COVID that immune resilience is critical, right? This is what it's all about. Forget autoimmune disease, immune resilience in COVID. These things that in this talk apply to that. Prebiotics, I like to tell patients prebiotics are what our probiotics eat. Obviously, that's very overly simplistic. Prebiotics are a type of plant fiber. They act as food or fertilizer for our probiotic bacteria, and they are needed to help probiotics stay alive and thrive. Prebiotics too can be found in food like artichokes, garlic, onion, asparagus, wheat, apple, and beans. And there's a great video I can share with you after this. Number 4, they say this is the last R, because remember it's 4 R's, but I like 5 R's. I include the 5th R, which is remain, but we'll talk about that later. Step 4, repair. This is the most important. Chronic inflammation, chronic stress can severely compromise the lining of our gut. And when we don't address this, there are further autoimmune challenges and nutrient deficiencies. That's why somebody with one autoimmune condition is at risk for a second and a third. If you have psoriasis, you're big time at risk for psoriatic arthritis or inflammatory bowel disease, and so on and so forth. We have to eat foods high in zinc, L-glutamine, vitamins A, D, and C, fatty acids, antioxidants, eat from the rainbow to support our immune function and restoring our gut health. Again, don't forget remain. Once we go through these 4, we need to make a pact to remain diligent, right? We don't have to be perfect, but remain diligent and in tune to our body. Supplemental nutrition, some of the important nutrients for those that suffer from autoimmune disease are vitamin D3. You heard a bunch of that about vitamin D3 with COVID. It's a pro-hormone. Immune cells have D3 receptors that help us adjust the balance of our immune response. And additionally, vitamin D can activate over 1,000 genes in our body. Zinc, this makes sense. Zinc is needed for our inflammation regulating cells. That's why we heard so much about it with COVID. Proper zinc levels play a huge role in coordinating the immune system's inflammation reaction. Glutathione's an antioxidant. It helps us detoxify, promotes healthy detoxification that breed inflammation, and it protects our body from oxidative stress and dysfunction. Omega-3 fatty acids, purely put, fish oil. When we have an excess of omega-6 fatty acids, that's from lousy food, that promotes inflammation. So it is important to counteract this buildup by taking in the proper amount of omega-3 fatty acids. So it is critical for us to recognize if we have an imbalance between these two, that is thought to be a leading cause in systemic inflammation and possibly autoimmune complications. So I tell patients, it took you a while to feel this lousy. It's going to take a bit to get you better. This is a process. As we deep dive to discover root cause and make appropriate lifestyle changes, I'm going to say, hey, patient, we need to implement some dietary adjustments here to ensure you sustain your optimal health. Again, that's part of the 5R, remain. So if we find out foods like gluten-containing foods, dairy, are something that particularly is the cause of your inflammation, we may need to permanently have those out of your long-term eating habits. In some folks, once they've combated the inflammation and we've strengthened their immune response, their body can sometimes react differently to foods that were once bothersome. In other words, we can sometimes reintroduce. Again, I can't give a specific diet plan for everyone because everyone is totally and incredibly different. That's the beauty of functional medicine. There is no algorithm. You have to look at each person individually. A comprehensive elimination diet can uncover our body's needs and our intolerances and reactions to certain foods. You have to be on an an elimination diet for at least 21 days to work to repair your gut before beginning to reintroduce possible potential food irritants. I've got a great paper copy of an elimination diet. I don't know if you have any experience with elimination diets, but that's a real inexpensive way for you to start healing. So detoxification, we're exposed to many toxins on a daily basis. It can be pesticides in our food, pollutants in the air, water contaminants, chemicals in our household products. Our bodies take in these things when we breathe, when we bathe, when we rub on shampoos and lotions. We ingest toxins constantly and have to reduce this toxic buildup. It is not just about buying an expensive detoxification kit for 14 days from Central Drug. We detoxify every day by sweating. We all can do that, by exercising and movement, and by drinking half of our body weight in water in ounces. If I weigh 150 pounds, then I need to drink 75 ounces of water so I can detoxify on a daily basis. I can get an air purification system. I can eat non-GMO, genetically modified foods. I can look at toxic-free household cleanups and proper nutrition. That all goes into detoxifying. Stress management. This is the hardest. I wish I had a magic pill here. Stress and disease go hand in hand. We are learning more and more about this. I talk to patients every day about stress and sugar, simple carbs, bad, bad, bad. When we don't manage stress in our diet, the body takes on the load, it becomes inflamed, and it develops or it worsens existing autoimmune conditions. Everyone manages their stress differently, but there's some great ideas here. Some you've heard of, some not. Deep breathing is cheap. It's simple to implement. I actually have it as a protocol for my patients to refer to continually. Yoga, massage, meditation, creating art, spending time with our loved ones, praying, practicing gratitude. Think consciously about how you manage your stress. I use these resources in this portion of the presentation. You are welcome to this list. I can send it out upon request, but I want to talk to you a little bit about a prescription I use in my practice and the pharmacy request for some of our providers when we treat their patients with autoimmune conditions. I am going to take one moment. And we're going to come back to talking about low-dose naltrexone. Low-dose naltrexone was discovered as naltrexone in 1963. The FDA approved it as a 50 milligram tablet or 100 milligram tablet to treat addiction to opioids and alcohol. 1984 for the opioids, 1994 for alcohol. So I tell many of my patients back in the 90s, I would prescribe a patient 100 milligrams of naltrexone to treat their opioid addiction. So we also now have Vivitrol naltrexone extended release injections. I don't do that anymore. That was approved in 2010. And that was for prevention of relapse of alcoholism or opioid dependence. So keep those doses in your mind, 50 milligrams and 100 milligrams. Low-dose naltrexone, LDN, that therapy was developed in 1985 by a doctor named Bahari, who was an internist. He was researching addiction, and he changed his research focus to AIDS when the AIDS epidemic occurred, because he found out that AIDS patients had 20% of the normal endorphin levels of healthy patients. So he discovered that if he used 1% of the normal dose of naltrexone, remember 50 milligrams and 100 milligrams, 1% of that dose caused a very unusual effect. It increased the patient's endorphin levels by 300%. That's huge. And you guys know endorphins equal feel-good chemicals in the brain, right? So that was a very compelling area of interest for him. So low-dose naltrexone, again, where it began, Dr. Bahari, he noted it didn't just benefit AIDS patients, but the normalizing effect that low-dose naltrexone had on the immune system, you could apply that to many autoimmune disorders. So that's where the big deal was. So before he died in 2010, he actually estimated that there were already between 30 and 40,000 patients using low-dose naltrexone nationwide. There has been an explosion of information about low-dose naltrexone, even since I started practicing functional medicine in 2015, but primarily since 2010. And the robustness of the data, it continues at a rapid pace. So again, the patent on naltrexone has expired 40 years ago, and we are still finding new ways to use low-dose naltrexone. We now think there's over 300 different disease states that can potentially be treated with naltrexone. We kind of have gone about this backwards. Usually a drug is approved, and then we find all these things, all these disease states that that can be helped with. With low-dose naltrexone, we've kind of gone backwards with that. Some experts now estimate that 20% of our population could potentially benefit from using low-dose naltrexone. So again, it is a powerful tool. It is an off-label prescription drug. It's something that has to be compounded in a compounding pharmacy. Potential use of low-dose naltrexone, just to differentiate. At the standard dose, naltrexone blocks opiate receptors and is used mainly in addiction therapy. That's the 50 milligrams, the 100 milligrams. When it's used in a low dose, it's widely understood now that it modulates our immune system. And we see it commonly prescribed. That's what I use in my practice when I have a patient with an autoimmune disease or any type of neuropathic pain. Because bottom line, low-dose naltrexone has general anti-inflammatory effects. How I prescribe it in my practice: start low, go slow. You can start a patient on 0.5 milligrams and titrate them up to the optimal dose of either somewhere between 3 and 6 milligrams. I like to start a patient on 1.5 milligrams capsule. They take it in the morning, and after about a week, they take 2 capsules. That's 3 milligrams. After another week, they take 3 capsules, and that's 4.5 milligrams. We are even seeing, I've just started doing this in my practice, to use 3 milligrams twice daily. That's a more common protocol, splitting that total dose. I always try reminding my patients we have to be patient. That is not a great trait that Cherise possesses, but to be patient, because sometimes it takes the patient 2 months, 3 months before they really think, man, I think I'm hurting a little less. I think I'm a little less swollen. Overall, my gut feels better in the case of ulcerative colitis or Crohn's. So you do have to be patient to see some benefit. Generally speaking, if I have a patient at 6 months who has not noticed any kind of change since they began taking low-dose naltrexone, I will stop it. And then sometimes we can back up and regroup and say, no, maybe I did feel a little better when I was on it. At any rate, because the opioid receptors of our brain, the way they function, low-dose naltrexone, optimally, you take it at night. But the side effects can be, I've not seen much headache, but I have seen insomnia. I have seen vivid dreams. So with my patients, I get them to take it in the morning. And once I get them titrated up to a dose that we think is effective for them, then we may think of saying, okay, let's take that 4.5 milligrams and let's try taking it at night now and see if it disrupts your sleep. Because if we, as we've talked before, if we don't have quality sleep, game is over, right? So at any rate, I'll do the titration up in the morning and then perhaps consider dosing it then in the evening, or giving it a trial in the evening. So at any rate, you heard of some supplementation, targeted supplementation. You've heard of lifestyle changes. You've heard of do not ever underestimate the role of stress and inflammation. So it's combating autoimmune disease naturally. And then we kind of ended up talking about a prescription we have now called low-dose naltrexone. I'm going to go ahead and start my video again. So we now have low-dose naltrexone as a tool as well. In my practice, the holy grail of treating autoimmune conditions is, and here's the bad news, because 2 out of 3 can be challenging. Number 1, 110% gluten-free. Number 2, gut health, and more gut health. And obviously that's tied into giving up gluten. Number 1, we have to look at digestion. We have to look at absorption. We have to look at bowel movement pattern, bloating pattern, reflux pattern. We have to optimize a person's gastrointestinal function. And then number 3 is if the patient's a candidate for low-dose naltrexone, because you cannot take it. I should have added that earlier. You can't take it if you're taking opioids or opiates for something else. Let's say you have a chronic spinal back pain that you take fentanyl patches or Lortab orally every day to manage your pain. That's somebody that cannot take low-dose naltrexone. And so you have to look at the patient person by person. At any rate, those are my 3 main targets of, there's many other things, but that's just kind of how I frame it to distill it down. Let's look at these 3 things. I want to thank you so much for your patience with audio problems earlier and letting me re-tape this so I can get this video out to everyone who was interested. We are sending the recording afterwards. Please, once you get a chance to watch this, those of you that were not here today, send Steve an email, send Central Drug an email, send my practice an email, pick up the phone, give us a call, stop by the store so we can answer your questions and see what we can do for you. Just reach out for help. I put our phone numbers there. There's about 6 different ways you can get a hold of us. Please reach out. We love to help, and autoimmune conditions are one of our passion because there's so many different tools that you can use. Thank you so much, and I will see you again soon. Take care.